Good morning. Welcome to this Action Forum. We're really pleased to have you here. My name is Alma Martinez. I am the Community Outreach Specialist for Community Medical Centers. And I just want to let you know that Community Medical Centers remains committed to leading and promoting community health and medical education. Without a doubt, one of our brightest shining stars leading those efforts is Brenna Hughes, which you will hear this morning. Her tireless efforts in educating the community as a whole, school nurses, school districts, parents, grandparents, medical residents, physicians, and athletes themselves, is a true testament to her passion and commitment to prevent serious life-altering injuries. Community Regional Medical Center is proud to partner with the children's movement in getting the word out on this very important topic. Thank you all. And with this, I would like to welcome, actually, we're gonna have Melissa speak next. So, April, I'm sorry. I'm baptizing her with a new name. April, good morning all, thank you.
Hey everybody. Good to see all of your beautiful faces. Thank you for spending your Friday morning with us. As part of the children's movement, we like to provide meaningful opportunities to build community. So oftentimes when we all meet together, we're talking more about what we do rather than who we are. So we're going to provide some opportunities right now to get a little bit deeper around who we are and build some community so we can start building the trust that's necessary to make some of those changes that we want to see in our communities. So our first question, do we have the slide for the first question? Awesome. So at your table, now if you find yourself with only 2 folks at your table or 3, it looks like we're in good groups right now, introduce yourself, and that introduction can include anything you'd like, your name, what organization you represent, your role in your family, however you want to introduce yourself. And you're going to talk about a time in your life when you stood up to an authority for something you believe in or something you wanted. So what happened and how did it change you and or the situation? So you may need to take a few seconds to kind of think about this. You can use your whole life as a reference, right? It could be at any point in your life. We've all done this in some way or another at some point in our lives. And I'm going to encourage you to pair with one other person, or if you're in 3s, you can do 3s as well. So in pairs or in 3s, and take a few minutes to talk about this together. We'll have about 5 to 7 minutes. We'll feel out the time. And then when our time is done, I'll go ahead and ring the bell. You'll hear the bell, okay? Does anybody have any questions before we begin? Okay, let's go ahead and get started. Great, thank you for coming back. Seeing some smiles and heard some great conversations. Wondering if anyone would like to share a story that they heard or that inspired them, or maybe just some bigger picture themes of things that came up in your conversations. We'd love to hear from you. And if you're going to share on behalf of someone else, just make sure that it's okay with them that you share with everyone that story, okay? I see right over here, Brooke.
So I'm sharing my partner's story, Lucy Babb from Clovis Unified, and we shared a similar themes in that she had an experience in her case in her childhood where she stood up to a teacher for saying something's not fair and got sent to the principal's office for it. Ultimately, there was no retaliation then, but it led her to becoming a teacher herself. And she constantly advocates for what she would perceive as injustice, right? Yeah, things that aren't fair for students. And we both agreed that that sometimes results in having a reputation of being a troublemaker.
Great, thank you for sharing that. We have another story right over here.
So I'm Kim Nystrom, guys, presiding judge of the Juvenile Delinquency Court, and I'm not going to share anybody's specifics. I just have to take a moment and say it is such a privilege to sit at the table with young women who are moving into leadership and who are willing to stand up and learning how to stand up for what they think is right. So as somebody who's not, those young women days are behind me, I'm really proud and privileged that we have young women and young men in our community who are willing to move into leadership and to learn how to contribute to their communities. So hats off to you guys. Good job.
Thank you so much. Are there other stories, thoughts that folks want to share? Things that came up in your conversations? Thank you.
My name is Stephanie Zimmerman. I think the one thing that stands out to me is a thing that a parent told us when my husband was in junior high ministry. And she said, some things are really hard to parent, but make amazing characteristics in an adult. And I think of the ability to say no as a kid is a hard thing to do. And it can be very frustrating as a parent to have a kid who's constantly telling you no. But if we can think of how we can guide that in a helpful direction and remind them that that's a character trait that they have, that stubbornness will serve them well, that we can then inspire that rather than shut down that part of them that's really good.
Thank you. We have time for one final share out if anyone feels so compelled. Anyone like to share? Great, Rocky, coming over there to you.
I'll share a story of, my story is gonna revolve around my children. If you've been here long enough, it's all about my children. I've always taught my kids to, maybe it's not necessarily stand up to authority, but to be able to say no to their friends when they know that it's not right. And one time, my son was at a party with his friends, and it was late at night, and so his friends wanted to go to the high school and go do whatever kids do at the high school. And he calls me and he said, "Hey, Dad, I'm gonna need you to come pick me up because my friends are gonna go to the high school, and I know you wouldn't like me going to the high school." So I told him I wasn't gonna go. So I go and I pick him up, and he's sitting outside the garage all by himself. He comes into the car, and he's all disappointed, and he was like, "It's so embarrassing. I have to wait here by myself while my friends are all gone." And I said, "Hey, you know what? I'm proud of you that you stood up. You know that I'm not gonna like it if you did something like that, and I'm proud of you that you stood up to your friends." And that moment kind of, created that little joy in my heart and say, "Hey, he actually listened to something I said." And so this past summer, he went to Coachella, and I was good, knowing that, hey, this kid's got something right, so he can go to Coachella. So he went to Coachella last summer.
Thanks, Rocky. Great. Thank you all so much for sharing your personal stories. A lot of us are in our professional lives and in our personal lives as well, challenging old paradigms, challenging authorities. So we're kind of priming ourselves to think about that as we go into our next TCM talk. Thank you all for being fully present and sharing of yourselves. I'm going to pass it over to Mary Jane for our next session.
Great. Good morning, everyone. Thank you, April. Can we give April a round of applause? Because it is not always easy to hold a room together and make people feel comfortable enough to share personal stories. So thank you, April. I am super excited to be able to introduce our TCM Talk speaker today. And click over to the clicky thing. Here we go. So, we've had a lot of conversations over the last year really talking about our young people in our community and a lot of ways that experiences that happen to them can affect them both sort of emotionally, right, but also biologically and physically. And those have some real consequences for some of the externalizing behaviors we might see young people presenting in their school environments, right, at home. We've talked a lot. We have Stephanie Zimmerman, who gave us a great talk about sort of like trauma, right, and ACEs, and how those things affect actual brain development, and the way that brain is able to process and react to different stimuli. We've also had great conversations about programs to help bring healing to our communities, right, around restorative justice and the different opportunities that we have to help sort of make whole again our children who have been through a lot of painful experiences. We've also just talked a lot about our early years, right, and how we can figure out ways to quickly know early on in a child's life what kind of challenges they might face so that we can build a lot of supports around them. So we've kind of been on this sort of journey for the last year and a half or so together in the children's movement, and we're just so excited to continue to explore these themes and bring issues that are sort of at the forefront in our national conversation, right, and bring in local folks who are working on that issue right here at home. So I'm really excited that today we're able to talk about sort of brain injuries and concussions. Those have been sort of big themes in our national discussion, right, with the movies and everything that have sort of been coming out and the topics that are going on around that. And we're super excited to be able to bring that issue right here at home. So it is my pleasure to introduce to you Brenna Hughes, who is the team lead for speech-language pathology at Community Regional Medical Center. And she founded the Central Valley Concussion Consortium in 2013 to improve appropriate resources for pediatric concussion patients in the region. Hughes has led a team of 21 speech-language pathologists in the acute care rehabilitation department at Community Regional, the only level 1 trauma center between Los Angeles and Sacramento, since 2012, and has worked at CRMC since 2007. The team works across a 909-bed hospital to assess and rehabilitate patients with cognitive, communicative, voice, and swallowing disorders as a result of acute stroke, traumatic brain injury, neuromuscular diseases, burns, cancer, cardiac respiratory failure, and other metabolic problems. She continues to co-facilitate monthly brain injury support groups held at CRMC. Brenna organized the first ever Central Valley Concussion Symposium held at the UCSF Fresno Medical Research Center in September 2013, and a second successful event in October 2015, and a third, write this date down, is scheduled for October 7th, 2017. This symposium seeks to increase concussion awareness and education for young athletes, parents, teachers, coaches, and medical professionals. She's guest lectured on mild traumatic brain injury at Fresno State, taught the undergraduate class in Neurobasis for Speech, Language, and Hearing at Fresno State in spring 2016, and has provided numerous lectures around Central California and was selected as a community hero by the College of Health and Human Services at Fresno State. She earned her BA in Communicative Disorders at San Diego State University and her Master's in Speech Language Pathology at Fresno State. Please give a warm welcome to Brenna Hughes.
Well, thank you so much for having me. I'm inspired by this group already. What an awesome exercise that was. I will say, just with full disclosure, that I'm definitely known as a troublemaker. And that started with working at a level 1 trauma center starting about 10 years ago. And it's very easy to see things that need to improve on a day-to-day. And it's very easy to go with the status quo, and it's very challenging when you don't. But it's fully worth the effort, as I've seen kind of over the years on this issue. I will say that the more I learn about brain injury, the more I know I don't know. And that's one of the things that I've learned. If you meet a professional that proclaims to know everything there is to know about brain injury, you need to question that. The real experts are the ones going through it and dealing with this issue, because every single one is different. And you're going to hear from one of those experts today, and it's not me. Another disclosure I want to mention is that I don't hate sports. I love sports. I was a Division I athlete. I played water polo for San Diego State. And I love sports, but I'm a true advocate when it comes to safety of kids, okay? So I'll consider it a win today if some of you take this information and share it with one person after you leave today, okay? All right, so before you leave,
what I hope you take with you is knowing truly what a concussion is. And I'm curious if you were to ask yourself right now, what is a concussion? What are some thoughts that come to mind as far as what a concussion is? Is it when you lose consciousness? What is it? If you were to ask yourself that right now. And then I hope you can instinctually perform your own risk management or risk assessment when you're talking about a kid with a brain injury. And learn to ask the question, why? Why are we at this point with this kid? What caused this kid to get to this point? Rather than looking at that, and our human nature is to look at the surface level and say, gosh, this kid's messed up. There's some issues here. But can we look past that? And then truly understand the short and long-term issues surrounding youth concussions and brain injuries. And you're going to hear me use concussions and brain injuries synonymously because a concussion is a brain injury, and we'll talk about that. And then I want you to identify the current issues and the call to action and the things that we need to do better in Fresno County, all across the Central Valley, especially here, a very sports-oriented area, to improve some of the long-term issues that I see at the trauma center. I see very young adults with a lot of issues: mental health, substance abuse, addiction issues, incarcerated adults, and it all stems from a very early age. And we're going to talk about that. Okay. I want you to meet Sam. Sam is one of many kids. I could give you an example, but I want to just give you a specific example today so you can kind of chew on that. Sam is from Hanford. I met him when he was 16 years old. And when I asked him, have you had any prior concussions? He told me no. He's a football player who came in with a spinal cord injury and a concussion. And I said, well, when I ask you if you have had any prior concussions, what does that mean to you? Oh, well, where you black out. I said, no, that's not a concussion. Have you ever hit your head and felt dizzy or dazed or stunned or didn't remember the play or felt woozy afterwards? Oh, that? Oh, yeah, I've had a lot of those. Okay, well, let's start with number 1. Okay, and let's get to number 5. That happened a week prior. He was still dizzy, still having headaches when he went back into the game, when he was cleared from a licensed healthcare professional to go back into the game, keep playing. And this is Sam learning how to walk again, okay? So we essentially insured by sending an impaired individual, a young child, back into a high-impact sport. We basically insured for him that he was going to have another concussion, at least. And we're lucky he's able to walk again. He was not able to return to school. He was homeschooled. He still gets anxious in large groups or environments with a lot of noise, stimulus. He was supposed to speak at one of our symposiums, and he wasn't able to do it. And I didn't fault him for that, for sure. So what is a concussion? Okay, an injury caused by a bump or blow or jolt to the body doesn't even have to be directly to the head. Okay, so let's be clear on that. My neurology friends would be very mad at me if I said you have to be hit in the head. It's not true. Okay? Anything that from a jolt to the body, a trauma, that causes you to it changes the way you think or feel. It may or may not result in loss of consciousness. In fact, most times it does not. Okay? It's not a bruise on the brain. It's a brain injury. It's an injury to your brain. It stretches and damages brain cells, causing chemical changes. It makes the brain more sensitive to repeated injury. And think about that one in the context of high-impact sports. Okay, we're going to get into this a little bit. We are putting children into an environment where we know it's a higher risk for them to have a brain injury. Yet we are not taking the appropriate precautions to keep them safe. So think about that. Walking down the street is less of a risk to have a brain injury than playing soccer. You know, we're going to get into the risk assessment and you guys being able to do that. It will not be visible on a CT scan. Talk about questioning authority, our exercise earlier. Every single day I have to question this myth with physicians, licensed healthcare doctors, professionals that have an MD next to their name believe this to be true. That if you have a concussion or a brain injury, you'll see it on a CT scan. And that couldn't be further from the truth. Another key thing I just wanted to mention is helmets do not prevent a concussion. They prevent a skull fracture, which is good. We want kids wearing helmets for sure on a bike, but it does not prevent that movement of that brain that's just like an egg floating on water, cerebral spinal fluid, from moving back and forth in your skull. So, key points, it can occur without a direct blow to the head, and it's likely to occur without a loss of consciousness. And you have a good picture here of a CT and an MRI. CTs are really good at showing blood. They're not very good at showing anything else, okay? So in the presence of a traumatic injury, like running into a volleyball net and falling backwards and hitting the concrete, these are real life examples I can give you every day. Fall off a bike with or without a helmet. A motor vehicle or motorcycle accident. A fall from a horse or kicked in the head by a horse. I could give you, I'll try not to get off topic with stories, but I'm thinking of kids as I'm stating these examples. And I could tell you about a kid who was kicked in the head by a horse and was told by a medical professional when he was having emotional issues his entire life. He was told by repeated medical professionals that this has nothing to do with his brain injury. The fact that he struggled his entire life and is where he is now is pretty astounding that he made it through the system. Ground level fall, hands stuck in jean pockets and just fell right on the concrete. An assault with fights, punches, kicks, blows to the head. So think about your kids in some of these socioeconomic areas and where they're coming from. And then we're putting them into high impact sports too. So think about that. Sports collisions between players. Ball to head to ground, head to head, foot to head, okay? Cheerleading, soccer, basketball, football, wrestling. It's not just football. I'm giving you these examples because I want you to be able to put it in context of a brain injury is a brain injury is a brain injury. It doesn't matter how you get it. It doesn't matter if it's a high impact sport. It doesn't matter if it's a car accident. It's the same thing. But for some reason, even as medical professionals, we have a bias towards sports. We want the kid to play. We want them to be able to keep playing and representing their schools or their professional teams. And so we put it in a different box in our mind. And that's where we need to challenge the status quo. Fall off the monkey bars, kicked in the head playing soccer in PE, fall from a chair reaching to get something up in class, object fell on head from a shelf in the classroom, and in many other ways. Here's your diagnostic criteria. So if a loss of consciousness occurs for less than 30 minutes, that falls into the mild range. Post-traumatic amnesia, meaning remembering minute to minute, less than 24 hours. CT is normal or negative. And then any loss of memory, any altered mental status, any disorientation, whether that lasts for 5 seconds or it lasts a lot longer, and any alteration in mental state, okay? I'm constantly questioning, is this mild or is this moderate? I don't tend to question, was this a brain injury? Because typically it's pretty obvious. But I typically will question, is this more of a moderate injury? And how I do that is by gauging the patient's self-awareness And self-awareness is, I don't feel good, I'm not 100%, I hit my head, versus, oh, I'm fine, no problems, as they're falling while walking down the hallway. So period of vulnerability. When we're talking about sports-related concussion, this is really, really important to remember. Another concussion after the point where that brain is still trying to heal can lead to irreparable damage. Okay, and this is a big one for our kids. When you have a concussion, you've got a headache, or maybe you just got a little dizziness. Remember, they're all different. The brain is trying to piece itself back together again. If we clear them too soon as medical professionals, or the school allows that to happen, even though we know there's some impairment or some deficits there, we're placing that child at risk for irreparable damage. Okay, it's not typically the first concussion that causes a problem. It might, but it's not typical. It's the repeated trauma while the brain's still trying to heal. So during this time, there's a mismatch. Okay, there's glucose, blood flow, there's this metabolic crisis. We're going to touch on, but I could spend 2 hours just talking about this metabolic crisis and what's happening in the brain. Research supports this can happen anywhere between 7 to 30 days, and longer if another concussion occurs during that time. So at a very minimum, the return to play after an initial concussion is 7 days. That's what the NFL goes by, supposedly. But the younger the child is and the more vulnerable they are, we need to be more conservative because there's a lot we don't know about the child's developing brain. We're in the infancy of figuring that out. So it should be more like 48 hours at each step, and it should be more like 2 weeks. Okay, so going back to your basic neuroanatomy, you have your neuron with your branches here, your dendrites, that capture that electrical impulse and send it down that axon, and then connect to a billion other nerve cells, neurons. This is what it looks like after a concussion. Okay, you have torn axons here, the most vulnerable part of the cell. You've got potassium leaving the cell, calcium trying to get in, and this metabolic crisis. And how do we know clinically this is happening? The kid's head hurts. He feels dizzy. He can't balance as good as he normally would. His vision's off. There's a lot of things going on clinically that we can ask the child how they're feeling, or we can see it in the classroom. They're sleeping, they've got cognitive fatigue, they can't think as well as they normally could or as fast. There's delayed responses. So we're going to show this video real quick so you guys can get an example of what's going on in the brain.
Within the brain are over 100 billion nerve cells, called neurons, sending electrical and chemical signals to and from the body. Each neuron has a cell body, a long nerve fiber called an axon, and projections of the cell body called dendrites. Dendrites extend out from the cell body to receive messages from other nerve cells. Axons in the brain connect neurons with each other, which in turn provide extensive interconnections with other brain areas. As the brain moves back and forth within the skull, areas of varying density in the brain slide over each other at different speeds. Axons crossing these junctions experience tremendous shearing forces, causing them to stretch and tear from the cell body. This event is called axonal shearing or diffuse axonal injury. Brain damage can continue to occur for hours or days after the initial injury. Damage to the axons can lead to a breakdown of communication among neurons in the brain. The torn axons quickly degenerate, releasing toxic levels of chemicals called neurotransmitters into the extracellular space. In turn, many of the surrounding neurons begin to die over the next 24 to 48 hours, worsening the initial effects of the injury.
So some key points when you're seeing these cells die here is that you could have thousands of axons torn with no blood, no bleeding. What is clinically significant to a physician, to a surgeon? When do we need to consult neurosurgery? When there's blood. We do not need to consult neurosurgery. We don't even need to fix anything as a physician if there's no bleeding, okay? But thousands and thousands of axons can be torn. So clinically significant, what I've come to realize over the last 10 years is to a trauma surgeon, they're the miracle workers. They have to save lives. They have to open people up and stop the bleeding and intubate and treat that. That's what they're good at, and we're glad they are. But brain injury, not something they're focused on. That's where rehab comes in. We have to focus on their transition back to school, back to work, back to everyday life, okay? So thousands of axons can be torn without any blood product at all. And sometimes when we initially evaluate, there's still stuff going on in the brain or the environment changes. That's what's so complex about the brain. It's not like a broken arm. We see it on x-ray and that's that. We know it's going to heal in a certain way. With the brain, there's a lot of stuff going on. It's so complex. So I might see them on day one and they don't have a headache. But then the next day they're in a noisy room with a noisy neighbor and their headache's a 10 out of 10. So that's things that we need to be able to monitor the transition of these kids, whether it's a car accident or a sports injury, back into the classroom safely. Symptoms. So I wanted to touch on this. These are just some symptoms. Headache, dizziness, nausea, vomiting, sensitivity to light and noise. How many of you guys would love to sit in a classroom in chemistry or geometry feeling like this? It wouldn't be very good. And to boot, how would you like to get in trouble for not paying attention, for feeling like this? And nobody knows why you're feeling like this. To the teacher on the outside, it just looks like you don't want to learn. You're not paying attention. So this is really important. You know, mild traumatic brain injury or concussion is known as a silent epidemic for this reason. There's a lot of things going on internally, how the patients feel, how the kids feel, but we can't see it on the outside. Okay. Unless we see this, okay? We see them holding their head. We turn on the lights. These should be red flags. I wanted to make this point. You have 1,800, let's say, NFL players. We've got about 50,000 NCAA players when we're talking about just one sport like football. Okay. In Fresno County, we've got, over 60,000 just high school students, right? And then we've got upwards of 100,000 students K through 8. Okay? So we need to be thinking about the fact that the research out there right now for brain injury is focused on the college players and up, okay? And we need to be overly cautious when we're talking about younger kids. All right. So what are we really talking about here to drive this point home? We're talking about 3 pounds of very soft, friable brain tissue. Those commissural fibers, the largest fibers in the brain, commissural fibers, the corpus callosum that connect the left and right hemisphere, are very, very vulnerable when you have impact to the head and neck or body. The younger you are, the more vulnerable your brain is. I actually learned the opposite when I was in school. I was taught the opposite. And now we know the younger you are, the more diffuse damage you'll have, and it affects that developmental period because your brain's developing until age 25. So when you have impact to the head and neck, that brain does not move in a nice, calm pattern. It shifts and it tears and it moves in all different directions. I mean, I could tell you story after story of, I've had a doctor tell me, oh, there's none of that head stuff going on, but I ordered you just in case. And I open the chart and it goes, 15-year-old traveling 100 miles an hour on a motorcycle hits a parked truck. So think about the mechanism of that head and neck. And yeah, when I walk in, the kid's alert. He's talking, but he's flat. He can't initiate. There's a lot of underlying cognitive things going on. Okay, so we have to get past the surface level. We have to think about the brain behind that face and the mechanism of injury. What's the big deal? Everything. Cognition, language, personality, respiratory function, cardiac. I'm going to show you some videos in a minute about some athletes. It's just amazing to me that we see some of these kids posturing, which tells us the brain stem is involved. They could have trouble breathing or their heart could stop moving or beating, but it's just not an emergency when it's sports. When it's a car accident, we see that, oh, it's a big deal. But in sports, for some reason, they're young, they're nimble. Proprioception, emotional control is one of the biggest issues that I see. And one of the biggest issues that leads to misdiagnosis. Pain and temperature, sensation, motor planning, olfactory, smell. A lot of football players lose their sense of smell from those olfactory nerves right in the front, rubbing against the skull. Auditory processing, balance, visual processing, reflexes. And I wanted to just bring a point, give you a visual of the frontal horns here. Your frontal lobes are the biggest lobes in the brain on both sides, and they're the most vulnerable to injury. And they rub on those ridges of those frontal horns there in the skull. So I'm going to show you a couple videos. If it's too much for you, just look away. It's kind of alarming when you see it in this context, a lot more alarming than when you see it every day, actually.
Right here waiting, staying strong, come and fall into me. You say you've turned it off, give your heart up on the shelf.
The thing with that is she just gets up and walks away. That's something that someone should be, C-spine precautions, head and neck stabilized. It's not viewed as an emergency. Oh, just dust yourself off, get up and get back out there. And that's a problem. That's a medical emergency right there.
Ooh. God, don't tell us. Who is that?
So this young child hit her head hard enough to lose consciousness.
That was call number 15, Stephanie Sampson, her first team third.
Got one more for you.
Franklin Long. Correction, Pleasant Grove Long.
This goes on for a few minutes, but not much of an emergency. Just kind of, oh, is he going to wake up, or what's the next step? What's going to happen here? Okay. Let's see. All right. So let's think about some short-term issues associated with what you just saw, which is happening all over the valley, because I get calls and emails on the weekly, if not daily, about these kinds of issues. Okay. Return to play with impairment. We're basically ensuring they're going to have another injury, and it's probably going to be worse to their brain and maybe physically worse. And they're going to have issues that catch up with them in the long term. They're going to have increased frustration in school, in the classroom. They're going to get burnt out. They can't focus. They can't concentrate. They have headaches. They have dizziness. And they don't get support from the classroom, from the teacher. I can't tell you how many phone calls I've made to schools because of parents contacting me saying, this happened and I can't get any help, and they don't know the formalized process and how to get that support. And the teacher, I just asked if, while he's recovering, that they maybe give him help in the classroom or untimed tests or something. He's trying to do well, but he just can't. So let's get this in perspective. We have a kid that's representing our school, playing a sport for us, who gets a brain injury, and then when they need help in the classroom, we say no. Absent or no diagnosis. That's one of the hardest things. Maybe the kid doesn't say. Maybe the friend doesn't say. Maybe they see it happen, but nobody tells the parents. Maybe the doctor doesn't understand. I'll just throw this out there. We've had issues with cultural disparities and some physicians not understanding American sports. Some school districts have gotten notes from physicians that say things like, can't play high-impact sports, only kicker. Or can't play football but can play basketball. And they don't necessarily understand the implications of that. And as school districts, it should be our responsibility to say, no, this isn't going to fly. If this kid's impaired, we've got to keep him out. So no self-awareness or ownership for problems, emotion, self-advocacy. If we don't have that diagnosis, that child loses the ability to own their injury. If you tell them they have a broken arm, they go, oh, I got to be careful with this arm. Right? I can't shower, I can't get my cast wet. They take ownership of that. But when there's no diagnosis to their brain and they're spiraling out of control emotionally, they turn to things like drugs. They turn to things like alcohol and risk-taking behavior, and then repetitive injury. So increased frustration with misdiagnosis. Maybe they get a psych diagnosis and now they're on a lot of heavy psych meds and it's not making them feel better. The medication's not working. Increased behavioral problems at school. Imagine that kid who's trying to do well but can't. And I hope all of you in this room are thinking about a kid right now, thinking about someone you've worked with, or thinking about maybe someone in your family, or thinking about someone going, maybe that's what's going on here. Behavioral problems at school, punishment for TBI-related behaviors without teacher or school being aware. I want to throw this out there. Less than 10% of teachers, school teachers, have formalized training in traumatic brain injury. So how many of those teachers do you think understand the implications of brain injury? Increasingly impulsive behaviors. Fights, self-medicating, anger due to lack of emotional control, poor response inhibition, meaning, someone says something to you, you want to say something back, but you're able to hold it in. Well, these kids lose that. They lose their filter. And then they end up in fights and having other issues. So when these kids become grown-ups, the long-term issues from repetitive concussions, and I'll tell you, I have a lot of them on my caseload weekly. They've lost social relationships, support, marriages. They drop out of school. They lose their jobs. They turn to alcohol and substances. And then big time, impulsive, adrenaline-seeking, risk-taking behaviors, which leads to repetitive injuries, and they just don't break that cycle. Incarceration can be a result of that. It fits the profile perfectly. And then the lack of social support, which contributes to all of that. And then the mental health problems, undiagnosed, depression, anxiety, suicidal ideation. Other misdiagnoses, things that I see because a medical professional did not take the time to get a differential diagnosis, and we just copy and pasted that history. They come to me with bipolar disorder, and I go, this doesn't fit. Tell me about your life. Tell me about your history. What kind of sports did you play? What kinds of extracurricular activities? Oh, motocross. Oh, high risk, right? As educators, as clinicians, our red flags should be jumping up everywhere when we hear something like that, high risk behavior for brain injury. Emotional disturbance, ADHD, PTSD, dyslexia, depression, anxiety. These are things that will carry these kids for a long time, but not necessarily give them the ownership over their injury and empower them to do something about it. So going back to the lack of awareness issue and the formalized training, this was a study that I pulled up. So what's out there? What's out there about this underdiagnosis? Because the CDC definitely recognizes this. In the state of California, there was an estimated 295 kids per 100,000 in the school system that should be identified with brain injury, at least 18,000 out of the 6 million. This is the number was actually identified, 1,800. So in other words, less than 2% of the kids that we should be identifying in the schools weren't. So think about that. It's the leading cause of disability in children and adolescents, but it's a low incidence disability educationally. So what does that mean? We're not identifying these kids in the schools, and we're definitely not identifying them in the hospital. Okay, this is something we're working to change, but this is data that we collected through our TBI program development, and between the years 2015 to 2016. These are how many patients were admitted with traumatic brain injury related injuries, traumas, multi-trauma orthopedic injuries. This isn't including the emergency department, so patients that came in and out on a Friday night or Saturday morning, but patients that were admitted likely because they needed orthopedic surgery or something else. That's how many were identified with the diagnosis of brain injury. Traumatic brain injury. There's a lot of reasons for that, coding and all kinds of stuff, but they had very specific diagnosis like subdural hematoma, subarachnoid hemorrhage, things like that. But the problem with that is, like going back to what we talked about with neurosurgery, is when you get a diagnosis like subdural hematoma, subarachnoid hemorrhage, it's being presented to you by the neurosurgeon who says, we don't need to do surgery. So you're good, you can go home. You'll feel better in a few weeks. Okay? They don't hear the words traumatic brain injury, and we talked about this early on. Every single patient is different after a brain injury. So that education about how you might feel in a noisy environment, how you might be a little bit more impulsive, how this could lead to another injury is missed, in that you have a subdural hematoma, you don't need surgery. Okay. So this study came out from neurology. If they do a larger study, this is going to have great implications as far as sports safety and parameters for kids. So what they looked at was basically critical neurodevelopmental period. They said kids that started playing tackle football under the age of 12 had greater cognitive impairments later in life. Is there a critical neurodevelopmental age? Dr. Giza thinks so, out of UCLA. And between the ages of 9 to 12, you can see all of these parts of the brain that are developing. The amygdala, that emotional control, that autonomic nervous system, hippocampal memory, regional peak gray matters, that tissue under the outer layer of the cortex, the cortical thickness, the outer layer of the brain, the genu and the splenium of the corpus callosum. So that picture I showed you earlier with all those commissural fibers, that middle of the brain, you can see why that would be more vulnerable with the movement of those lobes and the right and left hemisphere with trauma. The myelination rate, that outer protective layer of the brain, which, by the way, kids have less of because it's still developing. They have less developed neck muscles, lower cerebral blood volume, and less protective layer of the brain. And all of this is happening between the ages of 9 to 12. When do you see those kids out there looking like bobbleheads with those big heavy helmets? Kind of gives you the chills, at least it gives me the chills. This study showed age of first exposure to football. It divided some NFL players into two groups, under the age of 12 and over the age of 12 when they first were exposed to football. Okay, they controlled for age. So all of these patients were between the ages of 40 to 69, and they controlled for some other things. The kids who started playing tackle football before the age of 12 all had greater issues with executive function, mental flexibility, planning, organization, memory impairment. And this is just the beginning of this type of research. We're really in the infancy. No header, no brainer is a big campaign. Kids shouldn't be heading the ball early on. And I wanted to drive these points home. No brain injury is good. Brain injury at a younger age is really not good. Repeated brain injury at a young age is really, really not good. And repeated brain injury at a young age, really close together, is really, really, really not good. Not a good thing. These are some of the patients that I see at age 35 that cannot think, that have drug addiction problems, that have repeated brain injuries, and they're in that cycle that it's too late to break sometimes. This is just a picture of, for any of you that have seen that movie Concussion, okay, with Will Smith, this is what they're talking about. Dr. Amalu's research led to the diagnosis of chronic traumatic encephalopathy. And it's something where the brain tissue looks normal, but we can't see it. It's a neurodegenerative disease. It leads to all kinds of traits, some like Parkinson's, tremor, neurocognitive decline, memory problems, but the brain tissue looks normal. And this can only be diagnosed post-mortem, autopsy of the brain, thus far. The thing with brain injury, too, to keep in mind, is there's no real biomarker for it. What I mean by that is, if you're having a heart attack, there's a biomarker for that. They pull your troponins, the proteins in the heart, and they know your troponins are elevated and you're going to have a heart attack. Elevated creatinine, they know you're having some renal issues. So there's biomarkers for those things. Diabetes, same thing. But with brain injury, we're not there yet. That's where some research is going, developing different biomarkers and being able to look for tau in the CSF and those kinds of things, but we're not there yet. This is just a picture of normal brain tissue, healthy brain tissue on the left. In the middle is a football player, and then on the right is a boxer. So risk assessment exercise, I want you guys to get some practice with this, okay? What's a higher risk? Heading the ball or cleaning the ball? Heading the ball. It's a higher risk for brain injury. Soccer or chess tournament? Soccer. Okay. Cheerleading or team leading? Okay, cheerleading. Motor vehicle accident with positive blood alcohol level or negative blood alcohol level? Positive. You're driving drunk. That's a higher risk to have a brain injury. Snowboarding or building a snowman? Snowboarding. Skateboarding or a spelling bee? Skateboarding. When I meet a kid who skateboards, that's a super big red flag for brain injury. Motocross racer or golf pro? You could definitely get hit with a golf ball, but it's less risk compared to a motocross. Boxing or band member? Boxing, absolutely. Gang member or TCM member? I don't know. We'll see. But yeah, likely if you're in that environment, there's higher risk there. Cheerleading or choir? Cheerleading. Prior concussions or no prior concussions? Prior. If you've had brain injuries, the likelihood of you having another and another and another goes up and up and up. And oftentimes it's because they're in the same environment to where they had the brain injury. I want you guys to get comfortable thinking in that through that lens, through that perspective. It's okay to say different activities are higher risk, but we need to treat them accordingly. If we know these sports or recreational activities are high risk for brain injury, here's the question of the hour, then why are we not proactively educating? Not just here, sign a waiver, but proactively transcending that education, making sure everybody's aware, taking the appropriate accommodations in the classroom, making sure that transition is smooth for that kid. It might be informal, it might be temporary, but making sure it happens. All right, Lifestead law. Anybody heard of Zach Lifestead? 12-year-old up in Washington. This is where the first legislature, state legislature, came into play when a 12-year-old was carted off the field and he was airlifted to Seattle, underwent bilateral craniectomies, where they remove the skull outside of the brain on both sides. This is him after months of coma, months of rehab. He had what's called second impact syndrome, and we've had a few cases locally that I know of. He'll never be the same. He'll never be the same. When you watch a news article on one of the local cases, they're joking about how he's not playing football, but he's playing video game, Madden football now. And that's the news segment on this kid. A kid locally that will never be the same. His speech doesn't sound the same. His thinking, everything sounds different. But this is what prompted legislature statewide. When I first started doing these talks, I was saying, oh, okay, now 10, 12, 20 states have jumped on board. Now I'm happy to report that all 50 states have enacted TBI legislature. Most target youth sports concussion. These are the state laws in California. I kind of summarize them, but over the years, preseason waiver has to be signed, parent notification of the injury. High school coaches are trained in concussion, meaning they watch about a 5-minute video on the CDC Heads Up concussion website. It prohibits return to play until cleared by a licensed healthcare professional trained in concussion management. The problem is we have one physician that I know of that is brain injury certified in the whole Central Valley. And there's really not a certification for this. And so it's up to the physician to decide if they're competent to do that, which is great. But you can imagine the problems we have with this. And that's where school districts really need to kind of take a proactive role in this. Limited full contact practice. And another limitation, it doesn't mandate baseline testing. So this is the steps for return to play. Okay, we're running short. So this is the steps for return to play. So it's not just you look good, you're going back, okay? It's step by step. The first step is rest. You add that light aerobic exercise. If symptoms come back, you back up to the rest stage, and so on and so forth. Each of these levels should be between 24 to 48 hours, depending on that kid's age. This is what transition back to school should look like in any concussion. Notification of school, full history. We get instructions from the doctor. There's a designated point person, which is the most key piece. Then we start that return to play, return to school piece. My focus is return to school prior to return to play, but that's a whole nother issue. And then if they're still recovering, then we implement that formalized help. But if they're not, then great, we go to the green, and they get to go back to playing. But we make sure all these steps are followed. So call to action with all this information. We need improved awareness. That's where consortium comes in. We're really focusing on community education, and this is a great event for this. Improve reinforcement of graduated return to learn and play following a concussion in any setting. Increased accountability for coaches that don't take this issue seriously. We really need that administrative support. Some of these coaches just don't have the education. Some of them are kids themselves. I can't tell you how many coaches have given me deer in the headlight look at when they're at the bedside because they let this kid play after he lost consciousness in practice. They sat him out for a few minutes and then let him keep playing. Mandated baseline testing, that is long overdue in the Central Valley. That needs to happen. That's not even why are we in 2017 and not doing this? All school districts would have a TBI referral system, ideally, like I showed you. So under the special education, our athletics departments need to be collaborating with our specialized staff, our speech pathologists, our school psychologists. We should all be really heavily involved in this issue. This is brain injury we're talking about, the long-term lives of these kids. And physicians that are assessing and clearing kids to play and return to for concussions need to have some oversight from the school. If you're getting notes like, can play high-impact sports but only basketball, the school needs to step in and say, hold on, let's back up here. That my athletic trainer is seeing issues with this kid when he starts running. And more education, transdisciplinary approach, collaboration, and we need to be thinking about risk factors, extracurricular activities, and the sports. And the environments these kids are in, the risk that they have for this, we need to just be managing it as best as we can. So concussion's a brain injury, take it seriously. And then I want to introduce a very special person who's come into my life recently. She has been overcoming a lot of obstacles. Come on up. This is Kelsey, and she's here to kind of share her story with you today, and it's an impactful one. And she's still overcoming unsurmountable obstacles, but she wants to share her story with you today, so I'm glad she could be here.
Hello. Hi. I wrote something. All right. Okay. Do I need to bring it up? I talk loud. I don't know where I have that. It's okay. Stand here. I can scoot over. So. No, you're fine. Thank you, sir. Hello, can you guys hear me? Okay, this is my first time sharing my story outside the brain injury support group, so bear with me, I may cry. My name is Kelsey. I'm a former gymnast and a cheerleader of 5 years. 5 days a week, I was in the gym practicing learning new passes at cheer, where I danced, performed tumbling tricks, worked as a main base for the stunt group. The sole purpose of my job was to be the leader of the group, directing the stunts, and most importantly, not allowing my flyer to hit the floor. It was not typical that a 5-foot young lady had this position, but oftentimes when you are of shorter stature, you are the flyer or the second base, but I was born into a family where upper body strength was supreme to all attributes. In this position, I had to repeatedly catch my flyer from all sorts of aerial moves. At times, she completely leaves my hands and relies on her entire group to catch her. No matter what condition or situation I found myself in, I would risk my own safety before letting my flyer hit the floor. And in my 5 years, I never had a flyer injured. I took this role very seriously as I'm a dedicated team player. As a child, my family rule was to finish what we start, and we were never allowed to cry on the field. And many times in my sports career, I was notorious for finishing the game or routines despite injury, where later I would cry at home or off the field if I was in pain. As you know, playing a sport means that sometimes you play injured. I hardly ever showed discomfort as I felt it showed weakness, and that just came with my competitive nature. I was so dedicated to my flyer's safety that, like I said, I would put myself first. In my 5 years of cheerleading, I never injured, my flyer was never injured. In that 5 years, I accomplished a round-off back handspring layout, round-off back handspring back tuck, standing back handspring, and a standing back tuck. These are difficult maneuvers to master, and they take a fearless and dedicated athlete to accomplish them. I was in the works for learning a full twisting layout, which is a world-class move, before I decided I had enough. As you can imagine, in this time frame, I experienced several injuries, including head trauma. I remember very vividly learning my standing back tuck, which requires no hands and no running momentum to perform. I often would fall forward from under rotating, slamming forward on my face, leaving rug burns on my chin and nose. If we let go of our legs before landing, we are required to do push-ups on our knuckles. Because holding your legs is imperative to the rotation, and in order to master the move, each movement counted. While accomplishing our tricks was of the utmost importance, it seems looking back that the safety of our brain and head was not of paramount concern. While we do get spotted when first learning our tricks, there comes a time when doing them on your own is required, and facing that fear and overcoming it is what makes the difference between a successful gymnast and an unsuccessful one. As Coach always said, it's 90% mental, 10% physical. What ultimately ended my cheerleading career was the day I did a tumbling pass and landed on my head and neck. I was dizzy, disoriented, and ordered to perform the task again, because if not, I would psych myself out and not be able to do it again accurately. I was visibly upset, and my entire team was watching. With further orders from my coach, I did the pass. That night, I was nauseous, lethargic, and suffered from severe migraines. My mother gave me a hot bath, and I ended up going to bed early. The next day, I woke up and asked my mother if I could quit cheerleading. Despite my protest to the coach that I felt I was injured, I was forced to do another pass of tumbling, and quite frankly, it scared me. My mom allowed me to quit. I was only 16 years old. Looking back, I now realize that as my cheerleading career got more intense, my grades and cognitive abilities seemed to decline. I went from a girl who could sleep well at night, articulate fluently, get a 3.0 plus GPA yearly, to someone who suffered from insomnia. When I did get a good night's sleep, I couldn't get up in the morning. I began falling asleep in class even when rested. I wasn't able to comprehend reading material as well, despite my love for reading. I began lacking interest in simple things, and my attitude went from a typically emotionally sensitive person to aggressive and combative. My mother began getting worried and had me evaluated by doctors who deemed I was going through puberty and suffering from depression. This was diagnosed despite the fact I have no family history of psychological issues. I never claimed to feel depressed. Not one time in the history of my cheer career was it ever addressed that I may possibly have head injuries. These symptoms started for me at the age of 12 and peaked at the age of 16. It was when I was 16 I began self-medicating to get through the day. Through a sequence of events, I was exposed to elements that are typical to high school age children. I began going out and realized there were things that made me feel better. It was only 4 months after I was exposed to these elements that I told my parents I think I needed help. I was never in any kind of trouble, nor was I failing any classes at the time. I just knew something wasn't right. It was at this time I was sent away to addiction rehabilitation. In this rehabilitation, my head injuries again were never addressed or discussed. Being a hardcore gymnast was never the focus of my rehabilitation, yet our brain is the most important organ in our bodies. My family medical history does not warrant past addiction within the family, nor psychiatric issues, but I was prescribed psych meds and deemed an addict due to circumstance. When I was pregnant with my first son, I weaned myself off the psych medications because I didn't want him to be affected. And I felt better, but I was continuing to struggle with the aftermath of my head injuries, including insomnia, bouts of disorientation, and headaches. Later, I also discovered I was having seizures I never knew I was having that ultimately affected my quality of life. Months ago, I was changing my son's diaper in the middle of the night, and he kicked me in the head on accident. I suffered a seizure I had no idea that I had, and I became disoriented and recognized a feeling within myself I had felt before that was not normal. I self-medicated as if it was muscle memory despite my progress in life. This ultimately led me to my roof where, in desperation to feel better, I jumped, attempting suicide. What people fail to realize is TBI has no face. And going undiagnosed, it will rip through your life. It wasn't until I was prescribed seizure medications and properly treated for my conditions that I felt relief from symptoms. For 10 years, I fought severe headaches and cognitive impairment that was diagnosed through tests done at CRMC, and Brenna saved my life. My first major head injury in cheerleading coincides with the time frame of my self-medication. Not one person ever bothered to look into my possible concussion exposure. I've had multiple concussions over and over, untreated, undiagnosed, and I was put down a road of treatments that did not fit my family medical history nor my situation because of a lack of attention to detail. I've also been involved in the substance abuse unit through the juvenile justice system where I graduated, and it changed my life and made me a better person. I have been exposed to elements within a reckless life that have made lasting impressions on me and my family. I was able to become a successful pediatric phlebotomist for Valley Children's Hospital and Community Regional Medical Center. After suffering one head injury, you are more susceptible to head injuries with less force needed, and a simple kick to my head from a very strong 50-pound 2-year-old threw me into a situation that almost took my life. That night, I was a 5150 attempted suicide resulting in a broken tibia fibula, a subdermal hemorrhage that turned to a diagnosis of multiple undiagnosed sports-related traumatic brain injuries without psych issues. I was given proper care and finally treated for symptoms I've shared with physicians, but were ignored due to my previous diagnosis that were copied and pasted. It is imperative we address, diagnose, and treat our athletes when they receive a head injury. Our children represent our schools and our sports divisions, and we need to represent them by advocating for their safety. We cannot have productive lives if we do not care for the most important organ in our bodies that helps makes us who we are, our brains. Someday our youth will become mothers, fathers, aunts, uncles, doctors, nurses, lawyers, and teachers. But we cannot do that adequately, safely, and effectively if we aren't addressing these issues. Today is the day we must stand up and say, what is really going on and how can we better serve our community regarding this issue? I was a good student who comes from a grandfather who worked for NASA and a father who's a petroleum engineer. I dedicated my life to sports and representing my school and competition private cheer team. I gave my all to everything I have done in my life, and I'm here before you today urging you to listen and take action on this issue. We can save and change a lot of lives if we adequately address concussions. We can change the course of young lives and give a future a safer, better world to live in. I often wonder if my head injuries were adequately treated, would I have a different life? I don't know, but I'm here today. I'm walking this path in hopes my story will enlighten and motivate my peers to make a change and address concussions as a serious injury. We get one brain, one life, and one chance. We must make the best of what we are given in this life, because if we don't, we jeopardize the future of all those we walk amongst. The night on the roof, I had given up. I felt there was no other option. My heart felt like it didn't fit the brain it was in, and I truly tried so hard and did absolutely everything I was told to do to help my situation, and it was never enough. It was in that desperation I found my light. If I had died that night, I would have died with a different diagnosis and life story, resulting in other people possibly walking this same path. I am here for a reason. My brain injuries and concussions were uncovered and properly treated. I stand before you today walking a path that makes sense and getting treatment that is changing my life. I know if we adequately treat concussions and continue to advance in our studies and the effects it has on the brain, together we can properly educate our peers, provide safe and effective care, resulting in higher success rates and brighter futures within our community. Thank you.
Let's give another round of applause for Kelsey. Your courage is inspiring. Thank you so much for sharing that story with us. I know that we are all moved and thinking very differently now as a result of what Brenna and Kelsey have shared with us today. I wanted to provide space for folks to share their reflections, maybe some of the things that you're thinking, what you're processing. And Brenna and Kelsey, can you take questions as well if folks have questions? Yeah, so let's open it up. Are there questions or reflections that folks would like to share? Yes, I'm coming to you with the mic.
My daughter was diagnosed with bacterial meningitis when she was 7, and she was at Children's Hospital for 4 weeks. And she's 17 now. And a lot of the stuff that you talked about, I have seen with her. Is it possible with that, as they continue to grow, do you continue to see these types of long-term effects, even with that type of brain injury?
Yeah, so a lot of what we were talking about today was traumatic brain injury, but there's a lot of different types of brain injury. There's a lot of organic brain injuries. There can be anoxia, for example, lack of oxygen to the brain, or infectious brain injuries with infection of the brain, things like that. So absolutely could take this similar course of development with something like that at an early age. I don't know that case specifically, obviously, but is it a possibility? Absolutely, yeah.
Other questions or reflections? Sure.
I have 2 sons, and I refuse to let them play football because of a personal experience I had when I played football in high school. And this discussion certainly makes my position stronger inside in making that decision. I did let them play basketball and track, of course, but I did not let them play football because some injuries can stay with you for life.
Thank you. Okay, and then we'll get to you.
I was just wondering about migraines with brain injury, and like how some doctors just like, oh, it's hormonal or what have you. But I started horseback riding when I was 9. I fell off multiple horses, probably up until I was 20 when I stopped riding because I went to get my my degrees and what have you and have a family. And then recently, probably like 3 or 4 years ago, I fell off and I actually had a subdermal hematoma with bleeding on my brain. And I just wonder if over the years that I've had migraines, that if that has been something.
Absolutely. I mean, I get these kinds of questions every time I do a talk, and it's a self-realization thing, and a lot of people here are probably realizing, gosh, I had more concussions than I thought I did. And absolutely, and I think that's almost a direct result of lack of thorough investigation, thorough history taking by your physicians. Really, is nobody took the time to sit there and say, tell me about your life. Tell me about any brain trauma or, that kind of thing. I mean, if you think about it in school, when we learn about taking a history, it's a 10-page packet of questions. But how many of us licensed healthcare professionals sit there and ask all of those questions?
Well, and I have another thing to follow up on that with the suicides that are happening in our school districts. And knowing myself, at one time my migraines got so bad I just want to kill myself, and like my eyes felt like they're popping out of my head, and just this pain on a certain side of my head. And so I'm just wondering if they have looked into that with a lot of the suicides, especially those in like Clovis West, and just people wanting to take their lives because of just probably, and they talk about these were sports, the athletes, these are, people that were, kids that were, excelling, and then all of a sudden they just decided to commit suicide. And so I don't know if that's something that you guys have looked into as well.
I'll tell you, I had the same thoughts crossed my mind and the same questions. And I think the school districts could speak to that. But absolutely, whenever I see anything, and this is why we did that risk assessment exercise with you guys, and I hope that stays with you, is because whenever you see behavior that doesn't seem typical behavior for that age student or person, that we should be asking those questions. We should be saying, why have we gotten to this point? And we need to be investigating that. What is going on here? Besides that surface level human nature judgment that we see and we try to put cognitive closure to, we have to dig deeper and ask, why have we gotten to this point? And we really need to investigate those contributing factors, for sure.
Thank you for sharing your story. I know that you wanted to speak over here, sir.
My name is Juan Garza. I'm superintendent for a school district out in Reedley, Orange Cove, and the mountain areas. But reflections more than anything, not a question specific to you. And thank you so much for your touching story. I appreciate that. As a high school principal, I worked for a few years and as a superintendent to try to remove the program, the Pop Warner program, from the community members because I saw they didn't work with their grades or their behavior, the connection with school. And sometimes I saw that they would put kids back in there when they were using their judgment. Well-intended people in the community that want an activity for kids, and I need to say that. But I worked real hard to take the program away from them and put it into our middle schools where we had trainers on the sideline, certified trainers and teachers that were a little better prepared to handle injuries and academics for the kids, and expanded the concussion training for our coaches and our nurses. And what I realized today is that's not enough. That's really not enough. So I thank you. I know that there's continued work that needs to get done. And while I was proud of that, it's not over. We need to do more.
Good morning. My name is Mika, and I'm a school social worker for Fresno Unified. And this is a great presentation. It's made me open up my eyes on some of the questions I should be asking to the families I work with. And I sit on a multidisciplinary panel for our ISET program with the district. And I don't know how many times I've heard families say, well, because we ask them, we go through the ACEs and see where they score for trauma, kids that have gone through trauma. And how many times have I heard the parents say, well, when they were little, they would bang their heads. And maybe, I don't know, is that something that maybe we need to refer, or how do we follow up in providing support for a parent that shares that?
That's a great question. I mean, part of this issue is knowing the resources. What do? I get a good example of that is physicians that are retesting, post-injury testing kids because they've had concussions and their ultimate goal is to return to play. But at what point do we say, hold on, this isn't a concussion, this isn't going to resolve, and 10 months down the road we're still just testing them? At what point are they going to get help and intervention and therapy? And so knowing the resources, knowing speech pathologists do cognitive rehabilitation, for one, knowing that they need formalized support, whether it's a 504 or an IEP through their school district, and everybody needs to be aware. I mean, you guys all saw today a young adult taking ownership and being empowered by her injuries for the first time. So you guys were all here to see that. As she struggled for the last 10 years, and you saw her, how empowered she is taking ownership of that. And giving them that empowerment and that ownership starts with the actual diagnosis, the right diagnosis, and getting the right help. And so whether they're having dizziness and vestibular problems, that could be a physical therapy thing. There's a lot of support at Fresno State. There's a gait and balance clinic. There's a lot of outpatient services for physical therapy, occupational therapy, and speech therapy. And I promise you, if you get them into a rehab professional, they will take it from there. They know what to do. Thank you.
Like my good friend Juan, I'm also a superintendent in a rural community out in Fireball, and share some of those same concerns in regards to, especially after sharing today, that critical age where there's so much brain development still happening, that it's community and they mean the best. But I also look and reflect maybe some misconception that the football is the main culprit of concussions, and that the helmet-to-helmet contact over the last, I'm going to say, 3 or 4 years has been addressed. And I think there's a misconception. They think, okay, things are going to get better because we're not allowing that helmet-to-helmet, head-to-head contact. And listening to your presentation really gets me questioning more than ever that it's education we need out there, so they realize it doesn't necessarily have to be that blow to the head, because there's still major collisions on a football field when you have kids that are running as fast as they can, and kids that are 200 and some pounds hitting kids that are 170 pounds. So there's a lot of fear after listening to your presentation. I appreciate the presentation. Question in regards to, you talked about the baseline assessment. Can you elaborate any on the programs that are used for that and the importance of it? I know we do baseline assessment with our athletes, and in fact we do all athletes, because to me, I said, you could accidentally get a concussion playing tennis, and running cross country, you trip and fall, you're going to get a concussion. So we do all athletes, but I guess I'm looking for some reinforcement about the importance of that baseline.
One of the things is that with baseline testing, sometimes you identify a kid's already scoring lower than they should be. So that's one way to tease out the kids who have had prior concussions. So SCAT 5, it's fairly new. I don't know what happened to the SCAT 4, but they went from the SCAT 3 to the SCAT 5. That's one. I think the gold standard is impact testing. But baseline testing is testing the kid before the season. So we have a baseline of what their cognitive level is, or their scoring on those tests. And then the post-injury test after they have a concussion. We didn't get into a ton of detail, but after a concussion, you're going to take a big dip. Okay, they're not going to score very well immediately after. A baseline test is just one piece of the pie, but a lot of schools aren't doing it. So I commend you for doing that in your district. That's amazing to hear that. But we also need to look at things like neurocognitive stall we didn't get into today. But what we see is a lot of these kids, if we had a visual of how they're developing normally, and then when they have a concussion, they take a big dip, and then they come back up. The problem is they plateau. They don't continue on that normal developing curve. They plateau without the proper support. And so it might be something simple, like taking a break in the classroom when they get overstimulated, or untimed tests, or something really simple to bring them up to that normal developing curve and be able to perform with their peers, but they need that little bit of support. And sometimes it's informal, sometimes it's formalized. But going back to your question with the post-injury testing, the baseline testing, that's just one piece of the pie. We also need to look clinically, emotionally, behaviorally, cognitively, how are they performing in school is a really critical component. Does that answer your question? Or okay. Yeah, of course.
Okay, we have to sort of move on, but Brenna, you'll be here afterwards as well, so if you have more questions, I can take one more. I know I saw a hand up here somewhere. Okay.
I want to say, my name is Christopher De La Cerda. I work with Fresno Unified as a superintendent. I just want to say thank you for the presentation. I was just thinking about it as you talked about your injury, and I know the CIF is, this coming year, they're making cheer a competitive sport. And the one thing I continue to think about with cheer, because I have family members who have been in cheer throughout the years, is, you know, we talk about helmet to helmet. There's really no safety gear utilized in something like cheer. And I'm hoping that we have the superintendents here that are representing their respective districts and regions, that we make ourselves aware that what do we need to do to talk to CIF if they're going to make this a competitive sport to ensure some kind of safety requirement. And really there's, it seems to be in cheer, because the more competitive it's going to become, just like in football and baseball or tennis or whatever other sport, lacrosse, are they really going to have the ability to protect our athletes, because there is no gear that you wear during a cheer competition, or lacrosse for that matter, or for soccer. You don't see that kind of same safety gear. So I think it's imperative as the leaders of our respective schools that we make ourselves more aware, because this is an upfront issue with all of us. And to know that this is happening across our districts and our regions and our kids, I think this is important for us to address. So thank you.
Thank you. Can we get one more round of applause, please, for Brenna and Kelsey? Thank you so much. And don't forget, October 7th, 2017 is going to be the Concussion Symposium. I think there's a lot of educators and a lot of superintendents in the room. It might be worthwhile thinking about maybe an opportunity for you all to go and attend that together, and think about some of the opportunities and what types of staff you may want to attend, your athletic directors and other folks who could really benefit from that symposium. So I'm sure there'll be more information on that to follow. So don't forget that those opportunities are out there. And then I want us to transition next. We're going to have an update from our Cradle to Career group. And I think if it's okay, Linda, I'll just bring up Dr. Boyer. Okay, awesome. So I wanted to sort of transition. We're getting ready for the summer, right? I'm sure that doesn't surprise anyone that today, last week, and this week, and next week are going to be the last days of school as we're sort of transitioning into summer. And especially when we're thinking about young ones in our lives and our families, but also our neighbors and in our communities and the families that we work with, to make sure that we're providing great opportunities for them to remain engaged and to keep those little brains exercising throughout the summer. So one of the Cradle to Career work groups on summer learning has been hard at work preparing those opportunities, and there's a resource that they've developed in order to help you get connected to different opportunities for young people. And so we wanna make sure that you get this information. We'll also include in our recap email, so make sure you sign up and give us your email. You'll get some information about today's talk. You'll get access to the PowerPoint and the details that Brenna shared. You will get information about the symposium, and you will also get information about this resource directory here. So please welcome from the Summer Learning Work Group, Dr. Kimberly Boyer with the California Central Valley After School Foundation.
Thanks. Thank you. Good morning, everybody. I promise I'll be brief. I hope you can give me the little Oscar music if I need to. I'm going to try my best to can. My name's Kim Boyer. I'm Executive Director of the Central Valley After School Foundation, and for the last few years I've been an active member of the Children's Movement's summer work group. Over the past year, we've done quite a bit of work. We are a small but mighty group. We have some members here today. Misha Hackey with the Fresno County Libraries. Brooks has been incredibly supportive of this group as well, but definitely small but mighty. I wanted to provide you an update of what we've been doing as far as our summer work group goes, because we've kind of been operating kind of on our own and doing a few other things. But just to give you a little bit of background, for the last year I've served as the main facilitator for this group, and we took a little bit of a break and wanted to go back and reassess what this work group's purpose was and what we wanted to accomplish. So this year, we really wanted to build some background and get some information about our summer landscape, really figuring out what is out there in Fresno as far as summer learning goes, because it's so vast, right? So over the last year or two, we conducted a survey where we reached out to several different organizations in the Central Valley that are doing programs, some in the summer sector and some not, just to get a little bit of information, just, that shot in the dark of what is out there. So that became a big goal this year, to really kind of get to understand the landscape of quality summer learning, right? The other was thinking about access and learning a little bit more about how the community is accessing and learning about summer programs in our area. Because again, we all agree the importance of this summer learning time and the research around summer learning loss and how critical it is for kids to have active and engaging opportunities in the summer months, particularly youth in underserved areas, right? So one of the other things we did this year is we worked with Central Unified and did some parent focus groups where we talked to a couple of parents about summer. And not a surprise, many of them really, really find summer programs important and want their kids in some quality programs. But a lot of the issues they were dealing with had to do with access and learning about them. Where do we go to find the information? What's interesting is in talking with parents, we learned that much of them get their information from their schools themselves. The schools is really where they learn about what is out there, whether it's a flyer that gets distributed at their school, whether it's teachers, or whether it's the administrators that give them information. So in knowing that, we thought that was really important to think about how are families and everything getting information. So this year, we worked towards the goal of kind of understanding programs and then learning about how people are accessing these summer programs. I work with a lot of programs throughout the state on summer learning, and we actually got connected with an organization out of Oakland called In Play, and they have developed a summer directory for various areas throughout California, Oakland, San Francisco, and then they're developing one in Southern California. So they reached out to us and asked, they were very, very interested in the Central Valley and the work that's happening as far as summer, and wanted to partner with us to develop a directory. So this year we launched the summer directory. There are flyers, that look like they got distributed out, that look like this. And it's information. There's the website. And here's a little sampling of what this website looks like. We just launched it right after spring break. Does that sound right, Misha? We launched it right after spring break, and we've gotten quite a bit of exciting information about it as well. But this is just our start. This is just a start of what information we can put out there. So we were very strategic in how we wanted to communicate this. So in working with Central Unified, since they were huge supporters and some of them were members of our summer work group, wanted to help us with some of the communication. So information like these flyers were distributed to all of the elementary schools, again, knowing that parents get a lot of their information from their school sites about this website. And so we wanted to share it with you because we're very excited about where this directory can go. We definitely want to grow it, and we definitely want to build off of what we've started here. A few things. Let me make sure I've mentioned everything in here. So as far as just a couple of really cool information to share already is that just in the amount of time that it's been live is we've gotten over 500 plus unique hits to this website. And it's really cool because a chunk of them are localized from Central Unified, so obviously parents from the Central Unified schools are getting this information. But then a lot of it is word of mouth too, we're learning, just in the way that they're accessing the website. We're already getting a lot of unique hits to the libraries, to the Boys and Girls Club, Fresno County and San Joaquin River Parkway are some of the big ones. And a lot of that has to do with the communication as well. We reached out to all of the people that were focused on this directory, and they've done their own outreach. So in closing, I just wanted to please take the flyer if you haven't, and then distribute it out to your networks, because this is summertime. We're at summertime now. So if families and any of your networks are interested in what is out there in our area as far as summer learning goes, to refer them to this website. Like I said, we are a small but mighty group, and we're looking to grow our group. So if any of you are interested in wanting to learn a little bit more about our summer work group and get involved, please contact me, or I'll be around to talk with you, as well as Misha and other members of the summer work group. So please join us in being able to build this directory and make it a true resource for Fresno. Thanks.
Thank you. Yeah, it's always inspiring to hear about all the great work that y'all are already doing in your professional roles and in your roles in the community, coming together and doing the work, and also being able to take advantage of this time when we come together and just sort of share and reflect and then learn together, right? And really sort of modeling the type of learning that we're hoping our young people will get really excited about and continue to pursue into their adult lives, just like we are doing here. So I just wanted to thank you all. I know we're towards the end of our time. Right here, the next time we will all be together will be at our State of the Children breakfast. That's going to be happening in August, so Thursday, August 31st. We're really excited to bring to you our speaker, Arnold Chandler. He is a principal with Forward Change. So those of you who were here for Tia Martinez's talk at our last Action Forum, he works together with her as a partner to kind of continue to explore out different issues around how our systems and institutions can better support our young people, and really focusing on some different initiatives he's doing here locally with the Central Valley Community Foundation, helping them sort of bring their data measurement system to life in a way that helps us really kind of illustrate the sort of trajectories we're creating for our young people, both trajectories that lead to their opportunities and success, and also, unfortunately, trajectories that we have in place that sort of help them continue to fall farther and farther behind. So we're really excited to bring that talk to you. It should be super exciting over at the Clovis Veterans Memorial Building. So, you know, we get like 500 folks out there. So please register for that talk. You'll be getting information about that in our next e-blast as well. And we want to make sure that we have seats for you all. And if you're interested in sponsorships too, please make sure to reach out to Linda or Erica. You can give them a little wave. So we'll be happy to help talk to you about that too. So that'll be the next time we get together. It's really as we're getting ready to kick off the school year again. So that'll be exciting, and then we'll continue to have our action forums into the fall. I think the next one's in October. So we'll continue to move forward together there as well. So I just want to, on behalf of all of us here at the Children's Movement, just thank April for facilitating today, and the great job she always does there. Thanks again to our speakers, and thank you, Dr. Boyer, for sharing your updates, and for all of you for just taking time to be in this space together, to learn together, to share together, to reflect, and really to continue to sort of challenge ourselves and one another to continue to take action, and bolder action on behalf of the children in Fresno County. So we really just appreciate everything that you do. Hope you have a wonderful summer. Recharge yourself, or if you're out there working with folks, keep the energy going, and just really thank you so much, and we just really appreciate you, and we're looking forward to continuing to be just a stronger and bigger and bolder force for good here in Fresno. So thank you.